Good evening, I am Francis Diamante, and tonight I will be conducting a review of the section of dates regarding the general survey. So the general survey is the initial part of an encounter with the patient, wherein us doctors should try to utilize the general appearance of the patient to be able to derive a generalized judgment, which can later on aid us to arriving at a better understanding of the real status, the real condition of the patient with regards to his chief complaint. So, patient, tuloy po sila. Ayan. And good evening po sir. Ako po si Francis, third year med student sa UARM. Pwede po ba malaman ang pangalan nila?
Aaron Uy.
Ano po may tutulong ko sa nila, Sir Aaron?
Dok, yung dibdib ko kasi sumasakit.
Apo. Pwede ko lang po ba tanungin kung alam po nila kung nasaan po sila ngayon?
UE Hospital.
UE Hospital. Okay, thank you po, sir. So, first, we can assess in the general survey the level of consciousness of the patient. So, as we have seen, my patient right now is awake, alert, and responsive as he was able to answer correctly and attentively the questions that I have just asked him. Next, we observe for any signs of distress that the patient can show as he comes in. So, for example, cardiac or respiratory distress, which in this case, my patient was exhibiting clutching of the chest as he came in. So, maybe that can indicate respiratory distress. And then, I can also see that his chest was bringing him discomfort as he exhibited some protectiveness of this area right here. And then, another possible signs of distress could be anxiety or depression, which we can tell with just as simple as facial expressions of the patient as he comes in. And then, for another part of general survey that's very important is to look at the skin color, any discolorations or changes in skin color, or obvious lesions such as this one. So here we can already establish that my patient has suffered some trauma of some kind of laceration in his arm. We're just looking at it without even myself having to ask him any questions about it. Another part is how the patient is dressed, groomed, and how his personal hygiene overall looks. Because it's important to consider that. Because for instance, his outgrown hair or long nails could mean some underlying pathological disease, or maybe neglect of his hygiene and image would sometimes tend to give signs about depression or depression. Yeah. And then facial expressions that I have seen earlier, as I have mentioned earlier, as he walked in, he was exhibiting he was displaying some kind of disturbed facial expression. So maybe that I can already infer that he's undergoing through some pain. And then another important part of general survey is the odors of the body and breath, because odors can be important diagnostic clues like the fruity odor of diabetes or the scent of alcohol. But it's also very important to never assume that alcohol on a patient's breath explains changes in his mental status or in any deviations in neurologic findings. And second to the last part of the general survey is the posture, observing the posture, gait, or motor activity of the patient. As he came in, do you see that he is restless or agitated, or is there any involuntary motor activity, or a part that you can notice that is immobile or showing signs of paralysis? Posture, for instance, very important because some patients often prefer to be sit upright, in left-sided heart failure, or sometimes leaning forward with arms braced, which is could be indicative of COPD. And then lastly, for the height and weight, I would have to measure his height and weight with the necessary instruments. But then for measuring his height, I would have his shoes removed, and with the height and weight, I will be able to compute the BMI. There we go. The general survey. This one.